Yeah, that's definitely an important question, and I really hope that we'll continue to have more and more research efforts along those lines. So, disease relapse does remain the major risk of complications after an allogeneic stem cell transplant, particularly for myeloid malignancies such as AML and myelodysplastic syndrome. We are getting better at trying to identify the group of patients for whom the risk of relapse is going to be high, particularly through novel methods such as MRD analysis that helps us understand what's the depth of remission prior to transplant, because that definitely seems to be predictive of what could be the outcomes expected post-transplant. So with that MRD analysis, we are now looking into research strategies to see how can we adjust the transplant strategy, how can we adjust the post-transplant care to better target patient population for whom the risk of relapse is going to be high. We are not still fully covering 100% of those patient population yet, but we are getting more and more sophisticated in terms of trying to identify those high-risk patient population. I think once we identify those high-risk patient populations, it's a concurrent effort. What we are also doing is trying to monitor them post-transplant more closely with more in-depth analysis. Again, same way, not just the conventional analysis, MRD analysis by techniques such as flow cytometry, PCR or next-generation sequencing to see if there are targetable mutations or non-targetable high-risk mutations that increase the risk of relapse. And then potentially see if there are potential maintenance therapy strategies that can be done after transplant so that we can try to keep them in remission for a prolonged period of time and potentially, hopefully, avoid relapse post-transplant. It is an ongoing effort, but I do hope that we'll have more tools in our armamentarium to actually address those issues in the future.